Welcome to the Aced It podcast, where we turn science into sense. This is our 12th season of Aced It, and we're brought to you via the Justice Community Overdose Innovation Network, or JCOIN. I would like to celebrate a bit this season, for as we start season 12, we've reached 21,000 downloads and counting. Woohoo! Yeah, not because we're famous, certainly not, but because that means at least 21,000 times our listeners have learned something about overdose, opioids, opioid use disorder, medication-assisted treatment, and/or harm reduction. And that, my friends, warms my very grateful heart. Also, just a quick plug for a few other JCOIN features that you might not know about. Did you know you can get technical assistance for your organization from the experts at JCOIN for free? And did you know you can apply for small research grants to help fund innovative study ideas? Yep, through JCOIN. And did you know you can apply to be a JCOIN LEAP scholar or investigator to improve your own skills? Also through JCOIN. If you didn't know about these things, check out our website, jcoinctc.org, and learn about the many JCOIN offerings beyond Aced It that may help you learn and grow in ways that improve lives. With that, I'm honored that you're with us. I'm Danielle Roods, your host, and this is Aced It. As you've heard me say, and you probably know by now, this season of the Aced It podcast, season 12, we're talking all about roles, responsibilities, and reactions to overdose. By that, I mean we're going to examine how people in different environments and roles prevent and/or react to overdoses. Today, we're diving into first responders' experiences responding to drug-related overdoses. First responders include firefighters, emergency medical response, or EMS, and police. We'll cover the experiences of all these first responders today. And on our next episode, we'll do an even deeper dive on police experiences, since there's a lot of research out there about them specifically. Now, one of the tools most utilized by first responders responding to an overdose crisis is naloxone, a drug that quickly reverses the effects of an overdose. It has been widely distributed among first responders, harm reduction groups, and even lay people to combat the opioid crisis. But despite its effectiveness, perceptions of naloxone and its distribution remain complex and at times controversial. All right, let's start first by talking about first responders' perceptions of naloxone. Cruz and colleagues, 2022, examined how first responders perceive naloxone and the stigma associated with opioid use disorder, or OUD. Their survey of 282 police officers and EMT students found that participants generally held slightly negative attitudes toward naloxone use. First responders who had higher stigma toward opioid use disorder live and work in rural areas, and had previously administered naloxone and had more negative perceptions of naloxone. On the contrary, first responders who believed in the disease model of addiction and associated drug use with low socioeconomic status had more positive perceptions of naloxone. Similarly, Besson and colleagues, 2019, found that first responders in New Hampshire expressed concerns that greater naloxone availability might enable riskier opioid use and fail to address the root causes of addiction. Saunders and colleagues, 2019, also interviewed first responders in New Hampshire and found similar results, though they found that some first responders were supportive of naloxone due to its life-saving potential. For example, one interviewee said, quote, "If it helps a couple of kids make a good decision next time, if it gives them the opportunity to have that mea culpa moment or have that epiphany, then it's worth it," unquote. Similarly, Fitlow and colleagues, 2022, interviewed first responders in Montana, a quote-unquote frontier and remote state, and found that first responders supported the use of naloxone due to their inability to meet the needs of rural, geographically isolated residents, i.e., they couldn't respond to calls fast enough, and an overall lack of addiction services in remote areas. Okay, now, let's talk about emergency response and naloxone in action. Saunders and colleagues, 2019, lay out how 911 calls for service after an overdose typically play out. They write, quote, "After a medical call is placed to the 911 system, participants explain that EMS and the fire department are immediately dispatched, followed by the police department. Upon arriving at a potential overdose, emergency personnel used cues within the physical scene to determine whether an opioid overdose occurred by examining the patient's presentation and looking for drug paraphernalia. After stabilizing and reviving the patient, emergency personnel offered transport to the emergency department. unquote. Williams-Yoon and colleagues 2020 interviewed first responders in Vancouver, Canada, and reported that often bystanders were already involved in life-saving measures, such as administering naloxone or performing ventilation. In these cases, paramedics took on a leadership role by guiding bystanders. The good news is that in all of the studies we're talking about today, first responders consistently reported feeling confident in their ability to administer naloxone and assist patients. Various studies capture first responders' perceptions of and reactions to overdoses, focusing on perceptions of safety, emotional impacts, and policy issues. Let's talk about safety issues first. Williams-Yoon and colleagues 2020 found that navigating unseen hazards is a routine part of overdose response for paramedics, who rely on situational awareness, interpersonal skills, and assertiveness to ensure safety. First responders categorize risk into two types: immediate dangers, such as uncapped needles or agitated patients experiencing withdrawal, and potential hazards, like confined spaces, weapons, or unpredictable bystanders. While some paramedics acknowledge that overdose calls come with inherent risks, others describe feeling relatively safe, stating that dangerous situations were rare. These differing perceptions influenced their approach to scene management, including protective measures, communication strategies, and collaboration with law enforcement when necessary. For many, experience and preparedness played a crucial role in mitigating risks, shaping overdose response as either an unpredictable challenge or a manageable aspect of their work. Okay, now let's talk about the emotional toll of responders due to overdoses. Across studies, first responders repeatedly emphasized the emotional toll of responding to overdoses. In Williams-Yoon and colleagues' 2020 study that I mentioned before, first responders shared that they often felt sad, stressed, and what they called, quote, compassion fatigued, unquote, during and after overdose calls. Some first responders were bothered because they felt as though the care they were delivering was inadequate. For instance, one interviewee said, quote, "We're just going out and we're dealing with a symptom. We're not dealing with the issue," unquote. Saunders and colleagues 2019 found that first responders in New Hampshire reported feelings of burnout, helplessness, compassion fatigue, and post-traumatic stress among themselves or their coworkers. Some responders coped by seeking counseling or engaging in informal peer discussions, coping through humor or switching roles to minimize time in the field. Okay, finally, let's talk about some of the different policy issues that first responders discussed during interviews. Much of their conversations center around how first responders describe wanting to help, but feeling as though they are limited in how well they can assist patients after an overdose. According to Williams-Yoon and colleagues 2020, a significant part of this stemmed from connecting with patients' lived experiences. Listening to patients' stories helped responders understand different perspectives on drug use and addiction. After resuscitating overdose patients, paramedics often have had opportunities to engage with them personally during transport to hospitals or clinics. These interactions were described as formative, shaping responders' views on addiction. Additionally, paramedics saw themselves as both clinicians and patient advocates. While clinical assessment and resuscitation were fundamental aspects of overdose response, advocacy was another key responsibility, with paramedics leveraging their position as healthcare workers to connect patients with resources. While addiction treatment programs were the most commonly cited need, paramedics also sought to secure basic necessities such as blankets, meals, or temporary shelter. However, first responders in both the study conducted by Williams-Yoon and colleagues 2020 and Saunders and colleagues 2019 shared that connecting patients to services was challenging and out of their control. According to Saunders and colleagues 2019, barriers to treatment referrals existed at both patient and system levels. Many first responders cited a lack of patient interest or motivation immediately after an overdose, with about a quarter believing this hindered referrals. Systemic challenges included shortages in treatment facilities, resources, staff time, funding, and available services, especially for uninsured patients. Half of those interviewed expressed frustration over these gaps. Even when responders stabilized patients and offered transport to the hospital, many refused due to confusion or agitation. As one firefighter explained, quote, "Under the current law, as long as the patient is awake and talking, regardless of the event, they have the legal right to refuse. That's a challenge because that misses the opportunity to get these people where they need to be," unquote. The same sentiment was echoed in the study by Williams-Yoon and colleagues 2020. Okay, so now we finished reviewing the studies. What are the major takeaways? Well, first, naloxone remains a crucial tool in saving lives, but stigma persists among first responders. Training programs that emphasize the disease model of addiction and foster direct engagement with people who use drugs may help reduce that stigma and increase support for naloxone use. Second, the emotional impact on first responders cannot be ignored. Addressing burnout and providing mental health resources must be a priority. Finally, first responders discussed how linking patients to services post-overdose was challenging, and this area is clearly in need of attention and improvement. With that, we've reached the end of our episode on first responders' roles, responsibilities, and reactions to overdose. I hope you learned something new from this episode, and I'll talk to you next time. We'll be doing a deeper dive into police officers' perceptions of naloxone and reactions to overdose. Talk to you then. Thank you for listening to the Aced It podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write to me, Danielle Rudes, at Sam Houston State University. My email is drudes, D-R-U-D-E-S, at shsu.edu. And of course, thank you to the Justice Community Overdose Innovation Network, or JCOINS, Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters and also my fantastic doctoral students, Bryce Kushmerek-McCune and Jalen Magana. And a huge and heartfelt thank you to the team at Slunky LLC for their wonderful production as always. Remember to check out our website, jcoinctc.org, for more cool JCoin features and opportunities. And tune in again soon for another episode of Aced It.